the last test I want to go through is the Hruska adduction lift test. And with this test, I'm going to go through this test with Emily because I think it's kind of fun to go through it at the same time as about going through it with it step by step, but I'll do that in a minute. At a level 1, you guys, I want you guys to remember this test is always named for the leg that's on the shoulder of the person doing the test. So what we have shown here is a right Hruska adduction lift test, but it's really testing the left leg. But the test is named for the leg that's on the examiner's shoulder. A level 1 test is when they cannot take their ankle and put it up on this knee. If they can't do that, I want you guys to think about inhibition first. If I cannot abduct this completely and bring my foot up to the knee, I might want to think about inhibiting my right anterior outlet. Because my femur is going into abduction, which should help my outlet to be able to go into adduction. But if I can't bring my foot up to my knee, it might be because my outlet on the right side needs to be inhibited. It also could be because they have weakness with their right anterior inlet. And I have all of it written down for you. This description up here is what you guys are going to learn about in myokinematic respiration. I wanted to apply what you're going to learn in this class with what's going on with your pelvis. A level 1 is when they can bring their foot up to their knee. If they can't do that, this femur cannot get back. The outlet cannot open up. So it's more about the outlet's inability to abduct on the left side. You have to inhibit left outlet adduction. That's a left AIC pattern. Your left side is adducted. Your right side is abducted. Of level 2, now we're going to be talking about facilitation. If your patients get into this position and they cannot pick up this left knee, it could be because they have weakness with their left anterior outlet. My patients have got to be able to feel their left adductor with this test, and they've also got to be able to feel their left glute med. When you guys have a pelvic ascension drop test that is still positive, I got a little cocky, Emily, because I know you don't have an adduction lift test of a 2 out of 5. Because if you could feel your left adductor and feel your left glute med with this test, your pelvic ascension drop test would do what? Go negative. So when you guys have a pelvic ascension drop test that's positive, you're stuck at 2, 0, 1, or 2. I'll guarantee it. And if your patients can pick up their left knee and feel their left adductor, but they can't feel their left glute med, what do you got to work on? A left glute med. If they can't pick up their left leg and they can't feel their left adductor, where do you got to start? They got to work on their left adductor so you can work on strengthening a left obturator internus and a left iliococcygeus. I want to make life easy for you as a clinician so you know where to go in that file box to know what exercise to give your patient. You don't want to go work on a right glute max activity if you don't have a pelvic ascension drop test. It's what? Negative. In order to get up to a level 3, they've got to be able to keep this left knee up, feel their adductor, feel their glute med, and they've got to be able to pick this hip up off the floor. And if they can't do it, I want you guys to think about weakness of their right posterior outlet. Your glute max, your piriformis, and your coccygeus should be able to help lift that leg up off, that hip up off the table. So if they can't get from a 2 to a 3, you're going to focus on a right glute max. In order to get to a level 4, they've got to be able to pick this hip up higher. My patients have got to be able to demonstrate for me that they can pull this in. When they do this test, they'll try to do it out here with their right IOs and TAs. I want them to be able to lift up and feel their left IOs and TAs. So if they can't get from a level 3 to a level 4, they've got to work on what? Abs. And if my patients don't have a level 4 where they can feel their left abs, am I going to work on right trunk rotation? No. Because how are you going to secure a rib cage if you don't have a left ab? So you're going to do stuff upright where you can integrate your left glute med or your left iliacus, where you can integrate your left anterior outlet, and you're going to integrate that with abs and upright activity. If they can't get to a level 4 to a level 5, some of this they're going to need, they lack synchronization, they lack alternating activity, so you've got to do stuff that goes left, right, left.